So COVID happened. And for some people, COVID's over. That's what they believe. I actually don't think it's over. It's still, you can still get it. You still get damaged by it. And so what are the options for having a community that decides that they don't want to have COVID circulating within their community and they wish to isolate from it? I know that when COVID first hit, there was entire communities that shut themselves off to the outside world. And I respect that. They had a gate that they put up or a checkpoint, and they only had people coming in and out for getting supplies and things like that. They decided they were not going to get hit with COVID, or they were going to at least try to not get hit with it. I respect that. And I actually would like to have a community that has people staying longer if they're visiting, and that there is a process for entering where we don't have many types of diseases come in, where there's a quarantine period. Perhaps people get tested for STDs as well, or even tuberculosis. I don't know how tuberculosis is transmitted, but some people have it and some people don't, and we usually ignore it. It doesn't matter to us. But if you get sick, if you're immunocompromised in some way, you can actually die from tuberculosis. It's a hidden disease that is very common. And so you could have whole communities of people that do not have tuberculosis and ones that do, so that you join one that fits in with your other values, which are a bunch of complex things, of course, but that you don't go in and spread tuberculosis within your community. COVID, you can get it multiple times. It gets in all parts of your body. It does damage every time you get it. It's not like the flu. It's much worse. Much more full system thing. And so I don't want to get it. I don't know if I've ever had it. And I avoid contact with people. I mean, I used to carry around a spray bottle with 70% alcohol in it, and I would even spray money in transactions when COVID was really going on and there was, mask mandates in much of the world and stuff. I'm not that careful anymore, but I really limit who I have contact with. I've only been in a car with 2 people in the last 6 years. Some of them multiple times, but I don't get in cars with people. I don't want close contact. When people visit me, I keep them 2 meters away from me. And my risk is pretty low because I live in such a rural location, and most people don't have COVID at any given time probably. But I would like to reduce my exposure to all kinds of things. And I would like to live in a community where people are highly conscious of that. Now, when I did have visitors after COVID, I said I had a policy where we are in quarantine because I, had close contact with them to some degree, and I just didn't want it on the property. I didn't want anybody to have COVID, and I also don't want them to get sick and have to take care of them. But there's an honesty issue going on here as well, and that like these folks went off the property, visited some people, played with the kids there, and then came back, and I didn't find that out till later. I find that annoying. I've hired a worker who visited and then was holding some people who were staying here's baby. And that is a violation of keeping people disease separated. And, that could even benefit for having less flus and colds and things. There are diseases which if we all isolated, and for example, STDs, if we all got tested and isolated for even a short time, we could almost get rid of that disease. And we could also not be randomly promiscuous. Like I had a woman come visit me, and she required that I get a bunch of health tests before she visited. Partly because we kind of knew we liked each other, and so she didn't want to get any STDs, and also she didn't want me to fall over, and get a, high cholesterol or whatever, something, heart attack or something like that. So she wanted me to get tested for stuff, and so I did. I got tested for her. I actually didn't require her to get tested, but part of it was an age thing. I'm older than her, so she wanted to make sure I was healthy, I guess, and she stayed for 5 years. So I was agreeable to that, and I think that might be something to do. Have COVID tests available, reduce risk, perhaps have part of your community be the people who go out and get supplies. So they're your expedition team, and they're taking more risks, but they're willing to. And that group might even, they'll try and reduce their risks as well, But then they would also be a group that was semi-isolated from the rest of the group, which was much more isolated and much more protected. So that's kind of how I imagine you could run an intentional community and protect yourself against various transmitted diseases, but I guess currently COVID is one that people are concerned with, or ought to be. I still am.